Okie doke. I'm going to get started on the introduction and everything because it's totally fine for people to not hear all of that. Welcome, everyone. My name's Zoe. Okay. Whoop. My name's Zoe. I'm a library associate here at Snow Libraries. Thank you for joining us for this evening's program, Learn to Discern Health Information with Liz Krause from the Center for an Informed Public. Before we get started, I just have a few pieces of housekeeping info to share. One, your camera and microphones are turned off and they'll remain so throughout the program, so please put your questions and comments into the chat window. If you can, please keep conversation in the chat on topic. That respects other people's ability to ask questions and enjoy the program. We'll have the opportunity at the end for a question and answer session, and we'll get to as many of your questions as possible. So we'll be using the chat to share links and information as well as pull your questions. Closed captioning is available during this presentation. It can be enabled by clicking the CC button at the bottom of your Zoom window. This event is being recorded and will be available on Snow Owl's YouTube library channel in a little over a week. So if you're watching and you think of someone who could really use this information, make sure to keep an eye out for it there. We already have the first two in our series of 4 available that way. It'll remain on the YouTube channel for about 5 years. And so now for our main event. Join me in welcoming Liz Krause. Liz Krause is a program manager at the University of Washington Center for an Informed Public, where she manages the Misinfo Day program that aims to help high school students, teachers, and librarians learn to navigate our complex information environment. In 2020, she co-founded Teachers for an Informed Public, a group of K-12 educators inspired by the CIP who work to bring information literacy education to their students and communities. And it's my honor today to have you join us. Thank you so much for coming. Really excited.
Great. Thank you. I am super excited to be here. I will get my slide shared. Here we go. Okay. So again, I'm Liz, very excited to be here with you all. Please feel free to use the chat and ask any questions, and we will get to them. I do want to put in a plug for the session that's coming after mine this Thursday, Facts Not Fighting, how to talk about misinformation. And I think especially with this topic that we're dealing with today around health information, some of you might have friends or family members that you're a little worried about some of the health information that they're seeing, and maybe you don't quite know how to approach it with them. So this next talk will be really helpful for that as well. I want to start today with my presentation with a story about my son. His name is Jasper. He is 2. And this is not like a medical horror story, anything. It's a very normal story, I think. Like 2 weeks ago, he developed a rash. And we, being, parents in the internet age, went to Google and tried to see, like, can we diagnose this rash? And you'll actually get a lot of fairly credible sources when you go to Google and say, like, what rash does my toddler have? And there's a lot of like reputable medical sites who will give you a visual guide of all the different rashes and tell you about them. And so we went through that and we couldn't quite figure out which one it was. But what we did notice is that all of the ones that these sites were showing us that it could be, pretty much all of them were like, you don't really need to do anything. This will go away on its own. It looks bad. It's annoying, but like you don't need medicine or anything. And so we thought, okay, well, seems like we don't need to do anything. And then a day or so went by, and I'm a mom, I worry. And so I kind of decided, you know what, actually, let's ask our doctor just to make sure that, this is actually okay, like Google told us it was, we think. And so we called the doctor and they said that basically the same thing when they talked to us on the phone. They said, yeah, most, childhood rashes, they get them and then they go away on their own. But send in some photos because it was the weekend, so we couldn't go in. So we sent in some photos and they called back and they said, oh no, you need antibiotics. Like that looks infected. And we thought, oh, well, good thing we didn't just go with our sort of what we thought we found out on Google answer, and we actually asked our doctor. So I start with this story as a kind of like way to frame health information in general. And when you have a specific health concern, it is so important to maybe bypass. You can go to Google if you want, but eventually to ask your doctor because they are the only person who is going to like see you in person. The internet cannot see you. They can't like notice things about your symptoms, etc. They don't know your history. So we'll just keep this as kind of like in the back of our mind as we're going through today. If you have a specific health concern, please ask a medical professional for sure. But we're all here today because we know that, there's a ton of information on the internet about health, some of it good, some of it bad, and we want to be able to evaluate that information ourselves. So I pulled out some headlines here. These go back to 2018 that kind of capture the current feeling around health information on the internet uh, from some people. So we have 2018, Dr. Google is a liar. These other headlines don't have the dates, but they're more recent about health misinformation being rampant on social media, how to reverse the alarming trend of health misinformation. And this worrying about, the amount of bad information out there on health, all came to a head with the COVID-19 pandemic, as I'm sure you're all aware. And it got so bad that the Surgeon General actually issued an advisory on building a healthy information environment called Confronting Health Misinformation. And you can read this here in the advisory. He says, I am urging all Americans to help slow the spread of health misinformation during the COVID-19 pandemic and beyond. Health misinformation is a serious threat to public health. It can cause confusion, sow mistrust, harm people's health, and undermine public health efforts. Limiting the spread of health misinformation is moral, a moral, and civic imperative that will require a whole of society effort. And part of what we can do to be part of that whole of society effort is educate ourselves on how can we evaluate this information that we are seeing like daily or hearing from friends or seeing on the news, etc. So what we're going to do today is we are going to go through some definitions. We're going to talk about some of the factors that led us to this situation. It's a complex problem, so there are like many things that we will not talk about, but we're going to hit on a few that I think are helpful. And we're going to talk about what we can do. So first, what is misinformation when we're talking about that? Misinformation is information that is false, but not necessarily intentionally false. So you can think misinformation, mistake. Someone does not realize they're saying something that's misleading or not true. They think it's correct and they're trying to share correct information. Disinformation, on the other hand, is false or misleading information that is deliberately shared for a reason, financial, political, reputational, other reasons. There's a goal. Someone knows it's wrong, but they're sharing it anyway. And disinformation can get tricky because it is often partly true, but then layered with other exaggerations or distortions or taken out of context. And disinformation, also a hallmark of it, is that it functions as a campaign. So it's not just one post that is wrong. It's a set of multiple posts across multiple platforms trying to convince people of something or trying to just like sow mistrust. And so the difference between these two is the motivation, is the intent. And we see both of these happening with health information. So on the misinformation side, you have people sharing that because they're not certain of what's true. Maybe they're afraid and they're kind of trying to latch on to any information they can get, even if it's not correct. They're trying to inform people, they're trying to protect people. There's actually these good intentions there. And then on the disinformation side, you have that goal, the motivation of maybe a specific goal, like a political goal or something, trying to make money. Sometimes there can be like non, they're not trying to like achieve something for themselves. They're just trying to like spread chaos and sow distrust in general and make it so that all of us kind of look at the information ecosystem and think, well, it's a mess, and kind of throw up our hands and say, who knows what's true? We can't tell. Like, there's no point. We'll just kind of give up. And we see both of these coming up with health information. So there's a lot of misinformation. There's a lot of people believing that they are helping, sharing information that they think is helpful, that they like maybe have used, and maybe they feel like it's been transformative for them, and then they're trying to share that with the world. And then we also have people on the disinformation side who are trying to make money by maybe selling supplements that, they know are not actually doing what they say they're doing, but it's making them money, um, or even to achieve a political goal. And we can always throw in the just trying to spread chaos with this as well. And I want to note with these that it can be difficult if you're just looking at one piece of content, it can be difficult to determine intention often because you're not inside the head of the creator or the sharer of the information. So often, like, we don't know. This is an example that I find interesting. This is from TikTok. This is a woman who is saying that you should put borax, which is, used for laundry, you should like put a pinch of it into your whatever, your water, your coffee, whatever it is, in the morning daily, and you should be drinking that daily, and it's going to transform your life. She does have this little not medical advice asterisk here. But she has many, many videos on this and the positives of it as she sees it. And this is clearly like not true. You should not be drinking this. This is something found in like the cleaning aisle. Please do not eat it or ingest it. Um, but this one for me, she really seems like she believes in the benefits. She says that she's taking it. So like I would probably put this in the misinformation side, but also it's so seems so out there, and she has like these multiple videos of it, and I kind of wonder like, is there something else going on there that is more malicious or not? And you really many times you don't know. Okay, so some of the reasons that we're in this place right now. One is we're all vulnerable to misinformation, and that goes for health misinformation, any type of misinformation. People often like to think that they are too smart to fall for misinformation, and that's just not true. Like all of us, myself included, I do this every day. I am still vulnerable to falling for misinformation because it's just who we are as humans. So we kind of have to have that in the back of our minds in general. And why is this? It's because misinformation is design and disinformation are designed to get an emotional reaction. So they get more likes, more shares from your friends, your family, even you, and even me. When our emotions go up, our critical thinking goes down. This kind of unfortunately, how the human brain works. And especially when we're talking about health, our health is paramount. Our family's health is paramount. We will do anything to improve our own health and our family's health. We will do anything to try to avoid like negative impacts on our health. So especially when we are searching out answers about our health, it's a time when our emotions are like pretty high. The stakes are pretty high. And even if we're not searching things out and we're just, scrolling on our social media or watching the news, when health information comes to us and we see, oh, this thing is going to make my health better or my life better, or this thing, I should make sure I'm not doing this because that's definitely going to, kill me in 10 years or whatever, like that pulls at our heartstrings as well. And again, makes our critical thinking go down. And this happens especially online. So I'm going to talk through that. And to do that, I'm going to back up and talk about some ways that we can decide what's true. There's like two different ways we can think about this. We can decide what's true through a process called intuitive processing. And this is basically thinking like, does this feel true to me? I see this information, I hear this information. Does it feel true? And this is fast. This is like what our brain does automatically. Um, our brain's on vacation. It's not doing very much work. It's just like we're scrolling and we're kind of just making these split-second decisions about like, yeah, that seems true. Yeah, that seems false, etc. On the flip side, we can use analytical processing to try to figure out or decide if something is true. And this is much slower and our brain is working harder. We are actually pausing and taking the time to think, do I know that source? Does that source seem credible? Does that claim seem credible? Have I heard anything like that before? Etc. And so obviously, we're less vulnerable to misinformation when we're in that analytical processing mode. But if you think about which one the internet is designed to support and social media, we are definitely like pushed to that intuitive, fast processing. There's so much information coming at us all the time that if we stopped to think about each piece, we like for doing that for one day would take us, a long, long time. And just the way that our phones work and the infinite scroll, that's we're like literally going through information quickly. And there's not really things built into the system that encourage us to stop and pause and do that more analytical thinking. And even if we did stop and pause, often it's hard. The internet kind of pieces of information come sort of in these little like they come devoid of sources often. So like we could see this thing about borax, and it's not like there's an article that we can click on to look into it. There's not a source really beyond this one person who, most information on social media is just coming from like random people. You can't really investigate them. So even if you did stop and say, hey, I want to look into the source of this, like often it's not that easy to do that. And again, just hitting on when we're emotional, we're also in this kind of fast intuitive processing range. The second thing I want to talk about is the fact that health information is complex and individual. So something that works for one person might not work for another. Something that works under circumstances might not work under other circumstances, etc. So that can lead to, people making kind of big claims about something when actually the reality is much more nuanced and complex. Another piece of this is that science evolves, and that shows that science is working. And I'll give an example of this. When during the coronavirus, I don't know if you all remember, but toward the beginning of the pandemic in like March, April, a lot of us were like wiping down our groceries or leaving packages that were delivered outside and like not touching them for a day or something because we had this idea that like COVID spread on surfaces and that was how we were going to get it. And as time went on and people were able to study how COVID actually spread more, we learned that it's more spread through the air. The surfaces weren't as much of a concern. So they actually pretty quickly, this article is from not that many months into the pandemic, said, you can stop doing that. You don't need to do that. And so this is science working, right? They're studying something as time goes on, they're learning more about it, and they're updating the recommendations based on the new evidence that's coming to light. But if there's not great messaging around that, some people can look at something like that and say, well, you were telling us to do this, and now you're telling us not to do it. And it's like, so it seems like you don't really know what you're talking about. And like, who knows which I'm supposed to believe. So that can get in the way and cause people to kind of lose trust as well. And then another thing, as we talked about before, with disinformation specifically, there can often be a money element to this. I have this example up, there's also sites that sell supplements or things like that where they're, money-making industries. This example is from a Washington Post article that was talking about these influencer dietitians who were being funded by the food industry. And, that doesn't mean that the things they were saying weren't true, but the issue here was that they weren't disclosing that. Like they weren't disclosing the fact that that they were getting that funding and that some of these, may be conflicts of interest. Okay, so we've talked about some of the things, some of the reasons why we're kind of in this health misinformation mess that we're in. So now we're going to look at what can we do about it. And I'm breaking this up into a few different things. So what can we do when we encounter an unfamiliar health claim? What can we do when we encounter an unfamiliar health source? And what can we do if we have just a general health question, like we're going out to find health information? And I am going to use some of the steps in this method called SIFT. And you can see what it stands for there. We're going to go through the first three. And these are things that you can do once you have stopped and paused and your brain's working a little harder. These are some of the strategies you can use. And SIFT was created by Mike Caulfield. He is a former CIP research scientist. He's a digital literacy expert. And this method came about, and I want to say like 2017 or something like that. It's been years, so it's used in colleges and schools across the country. And it's helpful for checking things quickly. So your first step is to stop. So you can't check every piece of information you come across. So when should we stop to check if information we see or hear is true or not? And I'm sure you all have things that like red flags that make you check. And one that I want to add, if it's not on your list, is when we have a big emotional reaction. We talked about how when our emotions go up, our critical thinking goes down, but we can actually that seems like a negative. We can kind of flip it into a positive where if we can tune into our emotional reactions, we can like use that as a signal of like alert, alert, actually, let's stop and pause and think about this. So our emotions can kind of be like a beacon showing us like what should we be looking into more. All right, so let's try this with an unfamiliar health claim, or we'll see. I'm curious if any of you have seen this. And if you have, don't give it away. So this was on at least TikTok, maybe other platforms. And many people were doing this. It said garlic in the nose helps with congestion. And I won't show the video because it's kind of gross. But essentially people were placing garlic cloves into their nose and then they would take them out and you would see like a ton of mucus coming out. So basically like sort of showing the proof of like this is like, draining out all your congestion. Look at all this stuff coming out. And many people like doing this and saying like, yeah, it works. So my question for you all is, what's your initial reaction to this? And Gerald, I see your questions too. We'll get to those at the end. Yeah, just go ahead and you can type them into the chat. Ouch. Hard to believe. Fast. My reaction was ew. Oh, I think it was an allergic reaction. You're on to something there. Seems plausible, but require more research. Yeah, for sure. I mean, especially if you see the video, you're like, yeah, look at all that stuff coming out. Seems to be working. or irritation. Okay, so our first step is to stop because hopefully there's some sort of like wow or like what's going on there that's happening that makes you say, let's stop and look at this. And then there's kind of two options with pieces of information that you can take, and you can do both or you can just do one. So you can do what's called find better coverage of the claim. So like looking to see what have other people said about this idea of putting garlic in your nose, or you can investigate the source. So that would be, let's find out what we can about this person who's posting it and see if we can trust them, like if they seem credible just based on who they are. And in this case, since it's, TikTok, random person, we're probably not going to get much if we investigate the source. We could go to her page and see what other things she posts and kind of get an idea of like what type of content she has. But for this one, I think finding better coverage, like seeing what other people say, what other reliable sources say, and is there a consensus in those reliable sources about this? So if you Googled this, this is the top 3 results that I got when I Googled this. And as you can see, we have stuffing garlic in your nose will likely not help alleviate congestion, may cause your mucus to build up and irritate your mucous membranes, etc. One of the people in the chat knew that. We have another thing, can putting garlic in your nose relieve congestion. And then we have another one, garlic up the nose won't help your decongestion. Here's how. And yeah, if you did click into these articles, you would see that the mucus is coming out because it's like an irritated reaction to the garlic in your nose. It's not actually helping you. And so this one, I'm just going to click over to the search results here. And of course, we have our AI overview. So this one is pretty clear. You get multiple sources all saying the same thing. It's like been very covered. But you want to make sure when you're doing these searches that you're also paying attention to what the sources are that are coming up. So if you hadn't heard of the Cleveland Clinic before, if you didn't know like what's Mass Eye and Ear, today.com, I'm sure most of us have heard of, but today.com is also not like a health publication. So one way that you can make sure that you know these sources are credible, or at least look into them and see what you can find out about them, is by clicking on these 3 dots right here. I am curious, have any of you clicked on the 3 dots that come up next to your Google searches before? And if you have, you can just write like yes or me in the chat. Or never, that's also helpful. Thanks, Ellen. All right, one person has. No. No question mark, maybe I have. Okay, cool. So these are pretty wonderful for doing that other step of SIFT, which is investigate the source and making sure like, can I trust these results I'm getting? So these 3 dots, if you click on them, sorry, I have to move my Zoom screen around a little bit. You will get this box that comes up, and this works on like a laptop and a phone. And you will get this about the source. It's called the about the source box. And if the source is well known enough to have a Wikipedia page, you will get the first few sentences from the Wikipedia page, which can often be really helpful because if it's a source that has like major red flags, they will tell you that right in those first few sentences. If it is a source that doesn't have major red flags, you may have to, click in and read more about it just to make sure there's no like small red flags. But in this case, we see Cleveland Clinic is an American nonprofit academic medical center based in Cleveland. owned and operated, etc. We could click Wikipedia and be brought to the Cleveland Clinic's page. And if we did a little bit of scanning more about this, we'd see Cleveland Clinic is consistently ranked as one of the best hospitals in the United States, etc. And you could read more about that. So, we, in this case, we see Cleveland Clinic. Maybe you all have heard of it and already know, but just pretend you haven't. You might think, okay, that sounds like a medical institution. Let me see if it actually is a medical institution. Okay, yes, it is. And it's actually, one of the best. So me personally, I'm feeling pretty good about that source. And you can also click more about this page, and it will bring you, again, the same thing you saw from Wikipedia. If there's a Wikipedia, it will tell you what they say about themselves. This can be helpful, but also a bad source is never going to say, we're a bad source. We've been known to spread misinformation. Like that's never going to show up there. It's never going to show up in there about me, which is why we are looking at, what do other people say, looking at that Wikipedia article. Oh no, but then actually, look, troubling examples of pseudoscience at the Cleveland Clinic. So we could read through that and see what happened there. And it'll really give you, a a what's the word I'm looking for? It'll give you a view of like what are other people saying about this place, and what does that mean for if I feel like this is a good source or not. Oops. Okay. And so I kind of talked about this, but we really suggest Wikipedia as a good first stop and a good, if you are just looking to get a quick idea of, I'm on social media, I really just need like a 30-second, is this a good source or not? It will give you a summary of what others have to say about the source so you can get an idea of its reputation, because we're not really as interested in what the source says about itself as a first stop, because again, they're never going to say negative things about themselves. Okay, so I'm going to give you all a turn now. We have this study from you can see 2019. I love this one. It says we have travel and leisure on social media saying a new study says taking a hot bath burns as many calories as a 30-minute walk. And then we have this was also on the news on ABC study, hot baths beneficial, help lose weight. And some of you might be thinking, well, I know ABC News and I know Travel and Leisure. So like those are familiar sources to me. I know they're not like, crazy like bad sources. So I really like this example so you might be thinking, ABC did it, so probably true. Travel and Leisure said it, so probably true. And I would say that like this is a good example of you should be surprised, I think, by this. Like your emotional radar should be like, what? I can just take a bath and not exercise. So like using that sort of reaction barometer as like, oh, let's look into this, even though, it's by some well-known sources. So I'm gonna have you all go ahead, type this into Google and see what can you find about taking a hot bath, burning as many calories as a 30-minute walk. Can we all give up our walks and just take hot baths instead? And let's see what you can find in, let's say like 2 minutes. Oh, not frozen, just giving you time to look into this. I'll put it in the chat as well. All right, and just as I finished typing that, the original 2 minutes was up. So, okay, we've got Elisa saying eating well says it is. Okay. Okay, Ellen, you've got some thoughts. I wonder what, let's see, Snow Isle, so many articles, true. Can't find a scientific article. Must remain at a constant temperature for 1 hour. That's a good point. So yeah, lots of articles covering this because everyone wants to believe this, right? We can all just go take a bath instead of walking. So let's, oops, I'm just gonna X out of this and do my own. Oops, that didn't work. 1 second. Okay, here we go. All right, so let's look at the eating well one because that was the first one that came up, and someone says, as someone pointed out in the chat, so and we have that research proves, and so the art pretty much all of the articles say like yes, there was a study that said like this sentence is true. Like the people in the study, which was 14 men, were in a bath, as someone pointed out, for an hour. That was at a constant temperature of 104. And they burned about 140 calories, which is about as many as a 30-minute bath. So true, but only 14 people and only men, not women. And again, for an hour, at a constant temperature, etc. So lots of factors going into that. And also, you know, if you read through most of the articles, they will also point out like no one is saying don't exercise. You should still definitely exercise. And even if you went back to the study, which I wonder if they, yeah, so we have the study published in the journal Temperature, and you can actually, you know, you can look at the full study. I personally tried to look at it and was in way over my head. But they do point out in the study that they're thinking about this like heat method for people who like are on have like trouble exercising or like that's not really a thing that they can do. So like is there something else that could help those people have benefits that are similar? So this is one of those like, yes, technically true, but all these other things. And none of it adds up to we should all take baths instead of exercise. Let's see. Yeah, right. And the calories thing is interesting because, you know, that brings up a bigger question of like, you know, we burned as many calories and is that like what we should be thinking about? This Atlantic article at least talks about you know, hot baths burn calories, but like does it actually matter in this context when we're thinking about health? Like there's all these bigger questions as well. As we said, health information is nuanced and complex. But maybe we can all feel like, you know, with the baths that we are taking, we can feel good about them. They're burning some amount of calories. Okay, so now we're going to look at an unfamiliar health source. And I pulled up this website, the American College of Pediatricians, and I have a screenshot of just, the first part of it, enabling all children to reach their optimal physical and emotional health and well-being. And so if we were to look this up, and I'll just again go do this. So say this comes up, somebody's telling you, I don't know, you see this in your social media feed, someone's telling you about it, American College of Pediatricians. And so let's just Google that, American College of Pediatricians. And again, we get their website, but we're gonna skip past that because we don't really care about what they say about themselves yet. We want to see what other people have to say about their reputation. So again, we get a Wikipedia page, which you could get to from doing those three dots. And again, the point here is like, is this what we thought it was? So American College of Pediatricians, I would think, okay, professional organization of pediatricians, medical doctors. And that's what I would think it was. And when I go to see what it actually is, I learn socially conservative advocacy group of healthcare professionals. They are in favor of abstinence-only education, convergent therapy, advocates against vaccine mandates, etc. They have about 700 physicians, which again, if I'm like thinking about what I thought this was, it would have been much bigger. Have been listed as a hate group by Southern Poverty Law founder, etc. And they do have a very similar name to a group that is more like what you would think of when you think of this. They have American Academy of Pediatrics, which is the largest professional association of pediatricians in the United States, etc. And so you can it's one of the things there's an activity from a group that does uh digital literacy teaching, and they have them compare these two sites, like compare the American College of Pediatricians versus the American Academy of Pediatrics, and which one would be more credible for a certain thing that you're trying to figure out. And so you could again go back and do that about us little page with your three dots. You could go to more about this page. And again, you could read other articles, if you don't want to just look at the Wikipedia article and see what are people saying about them. All right, let's do another one for you all. Medline Plus. So this says Medline Plus, 25 years of health information, trusted health information for you. So I would like you to go ahead and Medline Plus, oops, I'm typing this into the chat, and see what you can find out about Medline Plus from reading what other people say, not going to their site, but seeing what other people say about them. And again, we'll do like 2 minutes. All right, take a few more seconds. Got some responses already coming in. Go ahead and add anything that you found out in the chat. Yep, government site. So this is a case where who they say they are and who they are is matching up. So they say, we're an online health information resource for patients and their family and friends, as someone pointed out in the chat, patients, family, and friends. Service of the National Library of Medicine, world's largest medical library, which is part of the National Institutes of Health. If you weren't familiar with those organizations, you could also look those up. They have Wikipedia pages. You can see what people say about them. And yes, .gov. So who they say they are and then who, other people say they are is matching up. This is no red flags here. And a great place to go for like consensus of what is said about different health issues. All right, so we have looked at so we've looked at like quick strategies that we can use to look up a claim that we see, to look up a source that we see. And I want to show another method or strategy or framework, really, that you can use when you're thinking about scientific information, medical information, especially. And this is from Jonathan Osborne and Daniel Pimentel. And this is from that article right there, Science, Misinformation, and the Role of Education. And they argue that what is really important when people like maybe we have some medical. Oh yeah, and Miriam, good point. Yeah, that can be a tactic that, an organization can use a name that's just like one word off and make people think it's something that it's not for sure. So sorry. Their argument is that science, including medical science, is highly specialized. So, there are many different types of medical professionals who all have very specialized expertise in their specific domain. Just like there are many types of scientists who all have very specialized expertise in their domain. And for us as people who don't have that training and don't have that expertise, we are not really going to be able to go and read through their study. Like I said, I went to that study, the original study, which is like definitely something I recommend, going to the original study. But sometimes you get into it and you're like, this is completely over my head, and I would need to, I'd need a dictionary and I need an encyclopedia to like get through this article. So he argues that we're not gonna have time to like become expert enough to kind of like understand these things ourselves. So what we need to become is competent outsiders, which means knowing that we don't have the training or the expertise, we can decide really what's the word I'm looking for? Decide really thoughtfully and competently, where do we spend our trust? If we realize that we are going to have to trust another person who does have the expertise to tell us what we need to know, how do we decide where to spend that trust? And they have this three-step process. So one, is the source of the information credible? And their evidence for credibility is no conflicts of interest, source acknowledged, unbiased analysis of the topic. And the second step, does the source have the expertise to vouch for the claim? And what I think is interesting about this and helpful is that they're separating out credibility and expertise, which I think often get you know, lumped together. If someone is expert, if someone's credible, that means they have the expertise. But by pulling this apart, they're showing, you know, we're actually thinking about different things. When we're thinking about credible, we're thinking about, you know, they've like those things that are listed there. And when we're thinking about expertise, we're thinking about, do they have a reputation among their peers? Do they have credentials and institutional context? Do they have relevant professional experience? So like you could be a credible medical professional or a credible scientist, but not have the expertise to be weighing in about the topic that you're trying to weigh in about, right? Like if you have, you don't want your cardiologist to do your brain surgery, right? They're both doctors, they're both credible people in their professions, but like in their specific domains. And once you decide those two things, like, yes, I've decided credible, yes, they have the expertise in this specific thing I'm looking up. And then you can look at, okay, is there a consensus among the relevant scientific experts? So you've decided that this one piece of information, this one source is credible. Now, like, where do they sort of lie within the consensus? And is there a consensus, or is it kind of an open, is there settled science, or is it like an open discussion? And I want to show one more example that really ties into this idea of expertise. And it is a science example. It's not technically a health example, but it's the same idea. And so we had this post going around in 2022 that said 1,000, like 1,100 scientists and professionals declare there is no climate emergency. And so people could see that and say, wow, that's a huge number. You can see this is they're saying in the comments here. Sorry, I'm looking for this. They have signed a World Climate Declaration stating there is no climate emergency. So that sounds, you know, very official to World Climate Declaration. And there's this many signatures from 15 different countries, etc. And the problem with this is that climate science is very specialized science. And when they actually went in, and this is AFP, they're a French publication, this is their fact check. When they went in and looked at who are these people that are signing this, it was 10 climatologists or climate scientists, fewer than 1% of the total. A few others describe themselves as specialists in paleoclimatology and atmospheric sciences. And then the additional people were 40 geophysicists, 130 geologists, and 200 engineers, mathematicians, medical doctors, and agricultural scientists. So all, you know, professionals, but almost, you know, fewer than 1% professionals in this actual field of climate science. And the same thing, I couldn't find any for this talk, but I know that I've seen examples of, you know, like this many doctors sign on to this thing saying this. And when you actually go and look at it, it's like, well, they're, you know, doctors from across many different domains and fields. And so that is this point of expertise becomes really important where you're looking, you know, someone in a white lab coat is telling you something, or in medical scrubs is telling you something, but like what are they actually trained in? What is their expertise in? All right. And our last one here is, what about when you just have we've been talking about kind of information that comes at us, that like seeks us out. What about when you are searching and you have a general health question? And I thought we'd use coffee for this. So maybe there's something, might not be coffee, but maybe there's something where you're like, what is just like the consensus on this thing that I've heard so many different things about? And so I use these coffee headlines. There may be a link between coffee and lung cancer. Coffee is good for you. Drinking 3 cups of coffee increases risk of migraine. Drinking coffee makes you live longer. There's many more. So, you know, there's many things like this. I feel like red wine has similar things. So it's like, what is the deal with coffee? I want to know if it's actually helping me or not. So we can use the same strategy we used before, where you literally just, you know, go to Google and you can look up coffee and health. And before we dive into the results, I want to point out that when you're doing searches around health information, you are going to get what you search for. So I very specifically wrote coffee and health because I didn't want to bias my search results. So when I did coffee and health, I got these were my top three. I have John Hopkins telling me 9 reasons why the right amount of coffee is good for you. I have Mayo Clinic saying, what does the research say about this? I have the American Medical Association, what doctors wish patients knew about the impact of caffeine. Um, if I searched benefits of coffee, so biasing my results to be, good things about coffee, I get the same John Hopkins, but then I also get Healthline, 9 benefits of coffee. I get Rush University, health benefits of coffee. So, I'm getting good things because that's what I searched for. And again, if I search harms of coffee, this was interesting because it was the only one that had sponsored posts show up. I don't know why. I'm not an expert on search engines, but that was interesting. So if you search harms of coffee, I got the truth about your coffee, about chemicals hiding in coffee, pros and cons of caffeine, and then again, that same AMA article. So some of the same sources showing up. And if you look down the results, there'd be some of the same ones as well. But especially when you're looking for health information, just trying to make sure that your searches are as neutral as possible so that you get the yeah, so that you're not biasing them accidentally. So if we did click into these, and I think that's what we have here, um, again, you'd want to, if you hadn't heard of John Hopkins or Mayo Clinic, you'd want to investigate those. I know about Mayo Clinic because my husband was born there and he manages to bring that up like at least once a month that it's the best place in the world. So anyway, I like these articles because we're going to look at the Mayo Clinic one and the AMA one. And I like them because they manage to give you a consensus of the science, but also point out like what is individual and like what is nuanced still. So with Mayo Clinic, we get does coffee offer health benefits? And I'm not going to read this whole thing, obviously, but just going to point out a few things. And they point out like how the science has changed. So past studies hinted that coffee might have a dark side, but new research suggests it may actually have benefits. And then they talk about why this reversal. And they say early on, research didn't take into account that heavy coffee drinkers also tended to use tobacco and be sedentary. So there were these confounding factors that newer studies adjusted for. And then they found, it may offer some protection against these things. It does still have risks. But, especially if you're pregnant, if you're trying to become pregnant, if you are drinking like unboiled, unfiltered coffee, like they kind of pointing out all the sort of nuances of this. But giving you, this is what the science kind of summarizing. This is what the science has said. And again, if we go to the American Medical Association page about caffeine, not necessarily coffee, but caffeine, they do what I thought was a great job of this too, where they say, the same thing. There are benefits that have shown up in the science, but again, pay attention to how much you're consuming. If you have insomnia, this is not for you. If you feel really anxious after you have caffeine, obviously this is not for you, etc. Like if you have too much, pointing out, so again, all the nuance there, but all in one place. So you don't have to rely on, one study says this. Okay. So we're wrapping up now, and I like this image from this is from the World Health Organization. They released this during the COVID pandemic, and when they were, really worried about all the vaccine misinformation that was going around and COVID misinformation. And they're using, this sort of virality chart to show here's some misleading information that was spreading, but then this person didn't share it. And look at all these people who didn't see that misleading information versus, these people who continued to share it. and it continued to be seen by larger and larger amounts of people. So this is our goal, right? We want to spread less bad information. And I wish I had like a green colored version of this where it was like, well, a credible source sharing credible information, and like a green one about like, and this person shared it and this person shared it. And it got to all these people. Because I think that sometimes we can feel like, we know there's a bunch of misleading information out there, and so we just kind of opt out from sharing, which um, I don't think is the answer. Like we still want the good information there. So I hope that you feel a little more confident that you can, feel good about I've looked into this and I feel good about sharing it with my network versus I've looked into this and yeah, I am not going to share it. And just some more positivity to end on. There are a lot of examples of physicians and medical professionals going into social media and having their own accounts and debunking or giving more context to a lot of the misinformation that's out there, doing that right on the platform. There was a great example during COVID. Trevor Bedford, who is at Fred Hutch, was doing these like great threads on how he was tracking the coronavirus evolution. And then we'll just circle back. This is my second to last slide. We'll circle back to that health advisory that we talked about in the beginning from the Surgeon General. And they have their own health misinformation checklist in that advisory. And it points out a lot of the things that we talked about here today. So, did you check with the CDC or local public health department to see if there's any information about this claim? Did you ask a credible healthcare professional, such as your doctor? Did you type the claim into a search engine to see if it has been verified by a credible source? Did you look at the About Us page? If you're not sure, don't share. Again, I would say About Us, sometimes helpful, sometimes not, because they're not going to say that they're not a good source. And then finally, I just want to kind of touch on the fact that some of you might have friends or family that you are concerned about because of the health information that they're seeing and acting on. And if that's you, the health advisory has some advice on how to talk to your friends and family about this. You can see kind of their main points there, but I can put the link in the chat to that. And then again, we have that talk coming up on Thursday about how you can talk about these things with people. And that brings me to the end. So thank you so much, and we will go to questions. And I'll stop sharing.
Wonderful. I'm going to go back in and see what questions we have in the chat here. There's been some really, really great comments and questions from people. Big thank you to everyone. It was very fun getting to see people looking at stuff and having just really good, interesting perspectives on getting to the right information. So thank you all for participating. We had towards the beginning, I'll start with some of the early questions. One of them was that do you think most people have a relationship with a doctor now or a healthcare institution, maybe?
Yeah, I mean, that's a great question. And I don't have an answer to that. I think it's totally individual. I'll just give a personal example because that's what I have. So I, was in Washington and I was with Kaiser and I would just, pick a different doctor for every appointment pretty much. So that was an institution. But I also, I got a breadth of people that I was working with and kind of heard from many different medical professions. Um, and I compare that to when I lived in like a smaller town and I did, I had my doctor who I went to and that was, the person. And yeah, I think it depends just on where you are. And I think even if you don't have like a single doctor, that's not necessarily a bad thing, if I'm taking your question correctly.
Yeah, I think that sort of gets the heart of it. I would, there's lots of different ways to relate to healthcare, and there's lots of different styles of healthcare, and a lot of that's just going to be predicated on what people's insurance situation is. They may not have a lot of control over it. Um, Now, somebody also said, is there any movement to improve health literacy, like on a national level? I know you
Mm.
mentioned a couple things that people have done, but anything you'd like to specifically call out?
Yeah, that is a great question. So I will put the link to the advisory because that definitely calls for different actions that many different groups can take. Um, I am not personally aware of specific initiatives, but I would be surprised if they didn't exist. But yeah, I can certainly put that link in the chat.
Awesome. Um, and there's a couple people pointing out, let's see here. Oh, um, talking about motivation and considering motivation in regards to checking the veracity of a claim, right? Um, and I was also one of the things I was interested in too was I was kind of reminded of that 9 out of 10 doctors thing when you separated credibility and expertise, right? What's the consensus among professionals specifically in that field? And then there's always going to be an outlier because we're humans.
Mhm.
Um,
Yeah, yeah, for sure. And that's why it's helpful to figure out like is there is there a consensus? Is it like a 50-50 split and people are just like it's totally an open question? Or is it, 90% to 10% or 95 to 5 or whatever it is? Um, and there's a great, I'll try to find it before we stop talking. There's a great little video on 9 of 10, this phenomenon that you're talking about,
yeah.
9 of 10. I think it's dentists and like
Yes, I
how
think that
all
is
those
it.
commercials for like 9 out of 10 dentists recommend our toothpaste or whatever it is. There's a great video that talks about like what does that actually mean? Like how are those companies able to say that? Um, so yeah, I'll try to.
Well, and I can also send out, if there's anything you think of that would be helpful, I can also send out a follow-up email for people who
Okay.
attended with some of the links posted in chat. So I'll try and do that tomorrow. That way you'll have people have access to them after we stop for the evening. Um, I also really like that idea of the fact that um, facts can change because that is definitely what we saw during the pandemic, that the consensus on something can change over time. And therefore, just because, I did a research paper in college and I know all about that does not mean now that, 10 years later, I'm still going to have all the settled information. Can definitely be different. As far as searching terms goes, are there, besides not putting in bias, are there any other tricks or tips you have for people to like, how do they maybe get the most relevant info? How do they parse that down so that they're not putting their own bias in?
Yeah, right. I think so, looking at the words, you're like avoiding any of those words like benefit, harm, etc. Is this good for me? Is this bad for me? Kind of thing. If you can just break it down to like what is the topic I want versus like what is the answer I want. Because a lot of times, sometimes this can happen with specific claims that you're looking into as well. So I'm trying to think of a good example. Um, but if you're, let's just use this as like a hypothetical. If you're looking at like putting, putting garlic in my nose as a way to like, putting garlic in my nose as a way to help with my cold. And you might, if there weren't all of those, if that claim hadn't gone like super viral and got all those fact checks, you might just find people like who are posting that and who are saying it, and you might not find like great information about it. Even if you do, like, say it's the same exact thing, you search the garlic and you see all these fact checks that say, no, this isn't a good thing to do. You haven't really answered your actual question, which is like, what do I do when I have a cold? How can I improve my symptoms? Like, what is the best way for me to improve my symptoms when I have a cold? Which is like sometimes you can feel like you're asking that when you're talking about these specific things, like, oh, I saw this was good for a cold. Let me figure out if it is. But it's like, really, you should just be searching what are the best things to do for this specific problem I have. And you'll get a completely different, Google search page that will be more helpful to you than maybe this like specific thing that you have searched.
Right, breaking it down to like I suppose asking yourself like, well, why does this appeal to me? What is, what do I actually want to know about this? I feel really crummy. What can I do about that instead? Right? I
Mhm.
think it's perfectly legitimate to have a conversation with yourself and be like, okay, why? Um,
For
I've
sure.
certainly felt crummy and Googled it.
Yeah, yeah, right. And one thing I want to say too about that with the search terms is if it is something that is like sort of you imagine it to be easily fact checkable, you can like type in your search terms and write fact check at the end, and then it'll pull up like the fact checking websites to the top, which can be a helpful time saver.
Yeah, that's a huge time saver. And I do really love the dots on the side. I think I learned about that from a Miss Info Day years ago that I got to attend and I'd never heard of it before.
Yeah,
Um,
it's very cool. Mike Caulfield, who made SIFT, actually worked with Google to make the like first version of that because he was always advocating for like Wikipedia is a really great place to go and we can build that into search so people don't actually have to open a new tab. I like Elisa's comment here too, or Alyssa, I hope I'm saying your name right. We don't know what we don't know. That is 100% true. Like that, what you're describing there, like you think you found something great, and then the doctor is like, well, no, that doesn't make any sense. Like that has 100% happened to me. And then, yeah, somebody sort of pushes on it just a little bit. And I'm like, oh yeah, doesn't make sense anymore.
well, and the biggest thing is that we're all vulnerable to misinformation, right? Doesn't matter whatever degree I have or whatnot, if it's not my area of expertise, I'm certainly vulnerable there. And even if it is, it's always good to get other opinions and see what the consensus is before moving forward. I think we'll wrap it up there. I'm not seeing a lot more questions, although really fun and great feedback from people. Thank you all so much. I want to give a big thank you to Liz um, for doing this. Yeah, we really appreciate it. If you can think of anyone who might find this program helpful, it should be up in a couple days or about a week on the Snow Owls YouTube channel, so feel free to share that along. And thank you all for listening to this presentation. Be sure to check the Snow website for more online events, including the rest of our program series with Center for an Informed Public. Um, we have Facts Not Fighting, How to Talk About Misinformation with Stacy Wedlake this Thursday, and I really encourage you to go and see that, especially leading up to the holiday season when we like to see family again. That's on October 24th at 5:30 to 7 as well. You can also find the last two programs that we partnered with Center for Informed Public on already. That was SOS, Spot Online Scams, and AI and Misinformation. You can find those on the Snow Owls YouTube channel online. Thank you all so much for joining us. Have a great night. We hope to see you again soon.
Thank you.